Hello medicos. So today we'll be discussing about the cardiac action potentials. So for knowing the cardiac action potential, first we'll see the three terms, that is chronotrophy, inotrophy and dromotrophy. So what is chronotrophy? It is the generation of the heart rate. Okay, so it is related to the heart rate. Then what we have is inotropy. Inotropy is the term used for the contractility of the ventricles. Then we have dromotrophy. Dromotrophy is the conduction of the impulse. Okay, so chronotrophy, inotrophy and the dromotrophy. Now let's see about the SA nodal action potential. So for the SA nodal action potential, we have this graph. Okay, on y-axis we have the amplitude, which is depicted in the millivolt, and x-axis we have the time. So these are the phases. So what are phases? We have the phase 4, phase 0 and phase 3. So what will happen in the phase 4? Phase 4 is the pre-potential phase. So from minus 40 the potential phase will start. So this is the pre-potential phase. In pre-potential phase, the voltage is minus 60 to minus 40 millivolt. So here the calcium influx will happen. Okay, so 4 may there is the calcium channel influx. Now for the calcium channels, we have two type of channels, that is the fast acting and the long acting calcium channels. Okay, so this fast acting calcium channel will called as the transient calcium channels. Okay, here we call transient calcium channels. Okay, then what we have next is a sodium funny current. Then this is for the phase 4, where the calcium channels will act for the pre-potential phase. Then we have the phase 0. Phase 0 is the depolarization phase. It is the depolarization phase. So it is due to the, here from minus 40 there is a beginning of the action potential. Okay, so here again the calcium channels will act, but here the long acting calcium channels will act. Okay, and then we have the phase 3. In phase 3 we called as repolarization phase. Okay, so repolarization phase, this is due to the efflux of the potassium. Okay, so this is due to the efflux of the potassium. So what we have seen is the first in the phase 4 there is the calcium channel influx. In phase 0 there is calcium channel influx and the sodium influx. Then in phase 3 we have the potassium efflux. So this is the SA nodal action potential graph. Okay, then we have the nerves, right? So two type of nerve, one is parasympathetic nerve and sympathetic nerve. This sympathetic nerve will increase the heart rate and parasympathetic nerve will decrease the heart rate. Okay, then we have the something called as the funny current. Okay, so what is this funny current, which is also called as hyperpolarization cyclic nucleotide channels. Okay, so this is also called as the hyperpolarization cyclic nucleotide channels. These are special type of sodium channels. So this funny currents or the funny channels is nothing but the special types. Okay, so this is the special type of the sodium channels only. Special type of the sodium channels which are present on the first is I and second is on the SA node of the heart. Okay, SA node of the heart. So when there is the heart rate of the patient will increase, what we will give is, like when in the patient with a pathological increase in the heart rate, that is nothing but the arrhythmia. Okay, so in the arrhythmia patient, when we'll give the ivabradine, okay, ivabradine, which is nothing but the new drug, which is calcium channel blocker. Okay, and this ivabradine will act on the SA node of the heart rate and causes the decrease in the heart rate. Okay, this will cause the decrease in the heart rate. by acting on the SA node, this ivabradine. Okay, ivabradine is a drug. Okay, so what is this causing decrease in the heart rate? But we know that this sodium current, these funny channels are present on the eye also. So this ivabradine will act on the eye also, and it will decreases the visual acuity. Okay, it will decrease the visual acuity. So what will happen is, if the patient is having arrhythmia, if we are giving the ivabradine, then it also acts upon the eye and decrease the visual acuity of the patient. So this is the one of the side effect of the ivabradine. Okay, this you should remember. Okay, so this is about the funny channels or funny current. Okay, now we'll see about the ventricular action potential. Ventricular action potential. So this is the graph. So here we have the phase 0, phase 1, phase 2, phase 3 and the phase 4. So what will happen in the phase 0? Phase 0 is the depolarization phase, right? So it is a depolarization phase. Phase 0 is a depolarization phase, and it is due to the sodium influx. Okay, it is due to the sodium influx. Then what we have, one is the early repolarization phase. Okay, early repolarization phase, and this is due to the potassium efflux. This is due to potassium efflux. Then we have this second, that is the plateau phase. Plateau phase, this is due to the this potassium efflux is balanced by the calcium channel influx. Okay, that's why this is plateau phase. But what happened is, at this end of this plateau phase, this calcium channel get closed, and the actual, that is the third phase, which is the late repolarization phase, will start, and this is completely due to the potassium efflux. Okay, then we have the phase 4, which is again the maintenance of the resting membrane potential. This is minus 90 millivolt. Okay, this is the phase 4. So this is the ventricular action potential. Okay, so now what we have, something called as the gap junctions. These are present in the intercalated disc. Intercalated disc in the cardiac muscle. Okay, in the cardiac muscle, this is present in intercalated disc. So what these gap junctions do means, due to these gap junctions, due to this, the impulse get rapidly conducted to the ventricular myocardium. Okay, so this is useful for the rapid conduction of the impulse through the ventricular myocardium. And in the gap junction, we have one specialized protein which is called as the connexins. This you should remember about the gap junctions. Then what we have next is conduction system of the heart, which is consist of the SA node, AV node, bundle of His and the Purkinje fibers. We'll see all of it. So first is the SA node, which is the dominant pacemaker of the heart. Dominant pacemaker of the heart. So here the highest rate of impulse gets generated. Okay, so SA node generate highest rate, means how much? This is 100 beats per minute. So SA node will generate the 100 beats per minute impulse at a normal rate, but our heart rate is 72 beats per minute, right? So this is due to the parasympathetic nerve action. Parasympathetic nerves. Okay, so these will maintain our heart rate at 72 beats per minute. Okay, but in the patient with heart transplant, their heart is denervated. That means there is no nerves. Okay, so what will happen is, the transplanted patient's heart will beat at the rate of the 100 beats per minute only, and this is normal in the post heart transplanted patients. This you should remember. Then next we have is the AV node. From SA node, this conduction impulse comes to the AV node, but here the 0.10 seconds delay in the conduction. Okay, and this delay is for the adequate relaxation of the ventricles. Adequate relaxation of the ventricles. So this is necessary. This much delay should be there. And this AV node, which is also called as the gatekeeper of the heart. Then next, through the bundle of hairs, this impulse will go to the Purkinje fibers. So these Purkinje fibers will supply the ventricles. And here the impulse conduction velocity. Okay, impulse conduction velocity will be the highest. And how much? This is 4 meter per second. Highest velocity. So this is all about the action potentials.